Hi, welcome to our Facebook Live. Today we're going to talk about post-op issues relating to porous implant ear reconstruction, so surgery that you do for Microtia. And we have some questions we're going to go through, hopefully give you a good idea of what to expect after you've had surgery. So I'm going to jump right in with question number 1. How long do you have to stay in California after surgery? Our patients that are coming from the United States typically stay 2 weeks and then they go back home, but we keep in close touch with you. International patients stay 4 weeks. Question number 2 is, what is the post-op aftercare? Obviously a source of stress for many parents because you don't exactly know till you're in it what's going on. But the first week, most important, for parents to understand, you have nothing to do except keep this kid's head dry. That's it. It's very well protected with a really detailed post-op dressing. And at week 1, your first post-op appointment, we're going to take off that dressing. Your kid gets a spa massage on their scalp from our awesome nurse, Maribel, who will, they will be very relaxed during that part. And then we assess your ear and we usually just wrap it back up so nobody can touch it for another week. You come back to see us the next week, post-op 2 weeks after surgery. And at that point, we're going to teach you how to clean the ear and care for the ear. And you'll probably be putting something on the ear twice a day, some type of an ointment or cream. And then after that, we keep in very close contact with you with emails. So you have to send us pictures and then we respond back with care. And we go week by week that way.
Hi, Jamie. I'm glad you found us on Facebook Live.
Aw. As for the ear cup, which is protecting the ear, we like you to wear it kind of 24/7 for the first 3 weeks, and then you just wear it at night only on the 4th week. One thing that we started maybe a year ago or so is the post-op bag. So what do we have here? This you usually get on your last appointment, and it's just meant to make life easy for everybody. So you get a lot of my favorite gauze. You're going to be using that to clean the ear. You get super special, super long Q-tips. We give you airplane-sized soap that we want you to use and hydrogen peroxide for cleaning. You get a variety of dressings. We teach you how to use those as well. And then some antibiotic ointment always comes in handy. We have a few other things. Oh, this tape is really awesome. Hypafix tape. It's the only thing that sticks to a kid, so I like that.
Angela
Anyways.
Sable and Shannon Sappington.
Oh, hi! Love you guys. Okay, that's our post-op bag, lovingly prepared by our wonderful staff. Then, okay, really important, also sort of new, last few months. This, your post-op wound care sheet, really, it has a ton of detailed information which people may or may not want to read, but I'm going to make you read it because it's really, really important. And it covers all kinds of things like, should I put ice on my kid's ear when it gets bumped? The answer is absolutely not, never, ever. These flaps do not do well with ice. What do I do if my kid gets a bug bite? Or, you know, how am I supposed to wash the ear? Or watch out for curling irons or things like that. So anyways, just sort of practical stuff, and we have you guys read that.
Haley Kellum says, hi, Dr. Lewin.
Oh, hi. Oh. Okay, question 3. When can my child return to school? If you live locally, not a whole lot of patients, you could go back as early as the 1st week because your kid is pretty much feeling quite well by the end of 1 week after surgery. But most people stick around California and actually spend their 2nd week traveling around local Southern California hot spots. So you go back at 2 weeks. When you go back home, you can go back to school. If a child or a parent isn't totally comfortable or they're worried their kid's going to be super active, you know, at kindergarten or whatnot, then maybe you would wait 3 weeks. Question 4. When can patients return to sports activities and swimming? And are there any sports that aren't allowed or encouraged? Pretty much you can go back to all sports at 6 weeks after surgery. when you do go back to swimming, we noticed, particularly if kids are spending a lot of time in the pool, you can get rashes on these new ears when they're still healing. And so we request that, you don't spend 7 hours in the pool, but, a couple hours, and then wash the ear off after swimming. Really, really important. That seems to have fixed the problem of those rashes. Then, really, in terms of sports that aren't encouraged, there's really just one big one. Okay, two. Boxing, really not a good idea. Cage fighting, also really not a good idea. Like ultimate sport, whatever those things are. Yeah, no, those would not be good for anybody getting an ear reconstruction. So, going on to our next question. When can a child wear, glasses, sunglasses, goggles, and headphones? Really, really good question. The issue becomes that if you have something rubbing along the ear, it could rub away at the brand new fresh skin graft, and so you really want to be careful with that. So we recommend 2 months before you do that, and just making sure there's either some padding or some cotton or something to prevent that. But we have a new Facebook private group. It's Dr. Cheryl Lewin Peer Questions and Connections or something like that. Did I get that right?
You got that right.
Okay, good. Anyways, that place is great for all these awesome tips. So somebody sent us a tip for goggles that work really well, but they're a soft band instead of those hard plastic bands. And people throw on all kinds of great helmet ideas and glasses and things like that. So we love that private group because it really, it's just parents helping other parents, which is the best way to go.
Hi, Hannah Cummings, Gross Hands family.
So the next one has to do with applying sunscreen. When, how, etc. For a couple months after surgery, when the ear is stable, we apply a scar cream. I use Biocornium, and it's got a sunscreen in it, so that's what we're going to use for protecting early. And then after that, a spray sunscreen, I just think is easy to apply, should be fine. The skin shouldn't get too irritated, just clean it off. Don't let it build up.
I have a question. Someone said, can kids spit stitches from this? I recently discovered I do, which is yuck.
So that is an interesting comment. Spitting stitches sometimes means that a stitch that's meant to be buried sort of eroded away, and you could then see it at the top of the skin. And it can happen not so much on the ear, usually where the skin graft donor site came from, so the tummy or the arm or something. Usually you can just pluck them out. It's not, I don't believe there's really so much, or I haven't seen an allergy to suture material or spitting because the body's rejecting the suture. People talk about it, but I haven't practically seen that. But you can have a single spitting suture here or there, and you just have to pluck them out, and then your body just heals over them. That's a good question. The next question is, what is the best post-op advice you can give? I feel like we send a lot of information to you guys, and we're trying, I know it's kind of a lot, but we're trying to give you the most comprehensive view of how to care for your ear. And it is in this, sheet that you're gonna get from us, which will be right after surgery. But a lot of our information will really go a long way towards helping you have a happy, healthy ear for a long, long time. The one thing, actually, I always pretty much say, and it's even highlighted at the very top of this, the most important thing to me, I am not going anywhere, not planning to go anywhere. My cell phone hasn't changed. Every single patient of mine has my cell phone. I don't care what time, day or night, weekend or not. If you have a problem with your ear, you need to call me or text me or email me. You email the office if it's during the week, you email me if it's during the weekend. Because most things, first of all, as long as you address them very quickly after your ear gets injured, we can fix just about anything. But if there's a delay, then it's just either harder to fix, or you know, potentially things just really progress to the point that, you know, I can't fix them long distance and I need to fix them, you know, maybe in the OR or something. So I don't say that to scare you, but I do say we are here, all of us. We want everybody to have a great experience, and so you just have to call us right away if something happens. I had had a couple families call me 3 to 5 weeks after surgery when their child's ear got a laceration, basically a cut, a big line on the brand new ear. Neither family flew back here. We talk you through how to care for that and deal with it. And then, you know, honestly, 6 months to a year after your ear's stable and you mostly forget about your ear, which is great. We're happy that that tends to be the course. But we, you know, parents and adult patients still need to look at that ear periodically and make sure there's nothing changing or going wrong. So.
Hi to Summer.
Oh, hi, Summer. Oh, wow, we got all our peeps. It's cool. I wish I could see you guys, but I'm glad you tuned in. So that covers all of our questions for our post-op. The last thing to tell you about, maybe the best way to get information about this is to come to a conference. And it's not just to see the surgeons that are at the conference, which is awesome, but you get, you know, a few minutes with each surgeon. But really, I think the big value is our awesome, awesome patients. And we have tremendous patients on our patient panel, and they're really amazing, and they really provide so much guidance and help and just moral support even for families that are at the beginning of this journey. So come to Chicago August 3rd this summer. Did I get that right?
You got that right.
Yay, that's twice. Okay, good. All right, you guys, thank you so much for tuning in. We'll do these periodically whenever Tiffany's in California.